In this video, we will talk about this drug levodopa plus carbidopa. So, in which disease this is used? This is used in Parkinsonism. So, what is Parkinsonism and why it occurs? Parkinsonism mostly occurs in old men more than females, right? It is a disease of basal ganglia because of decreased dopamine in the basal ganglia region, which causes movement disorder. Okay, so there is a movement disorder. In short, in this Parkinsonism, patient becomes slow. Okay, patient becomes slow. There is a rigidity, there are tremors in the patient, and hypo or bradykinesia. So patient is slow, patient is rigid, and there are tremors. And this occurs because of the disorder of the basal ganglia, and there is a decreased level of dopamine. So if this is our brain, this is our ventricles, okay, this is our hypothalamus, and there is this basal ganglia which is located. This is a caudate lobe of the basal ganglia. This is putamen. This is globus pallidus. Okay, and this is our thalamus. And there is a midbrain. Okay, and there is a midbrain where it is located, substantia nigra. And this substantia nigra secretes this dopamine. Right? So if dopamine is not enough in the brain, this basal ganglia activity is affected, and which will lead to all the symptoms of Parkinsonism. So what we can do is we can give them dopamine from outside. Like if patient is not making enough dopamine, we can give them from outside through medicine. Now the problem with dopamine is, if we give dopamine, okay, this is a protein, right? So it will get digested in the stomach and small intestine because of the protein enzymes. So we would develop the drug which was levodopa. So levodopa is a prodrug, and after absorption with the help of dopa decarboxylase enzyme, this gets converted into dopamine. So when we give this drug, okay, imagine that you have given the drug to the patient, it has reached the small intestine, it has reached the stomach, then the small intestine, then portal circulation, then in the liver, and then through the systemic circulation it has reached the brain. Okay, now in the brain it will act in the basal ganglia after converting into the dopamine with the help of dopa decarboxylase. Now you can imagine that the drug has to travel through this much of route before reaching it. So by the time it reaches the brain, most of the drug will get digested, okay, because this dopa decarboxylase enzyme will be present in this at many places, okay, in the body, in the circulation. So what will happen is this levodopa will get converted into dopamine, okay, in the circulation because of this enzyme before reaching the brain. So on one side we are getting less drug to the brain, okay, decrease amount of the drug to the brain, and also amount of dopamine in the circulation and in the systemic body is getting increased, and this can lead to arrhythmia. This can lead to changes in BP. So now what we can do is, so this was the problem with this drug. So our scientists developed another drug, that is carbidopa. Now this carbidopa is a drug that cannot enter the brain because it cannot cross the blood brain barrier. So when we give levodopa and carbidopa, what will happen is this carbidopa will not be able to enter the brain, but this levodopa will reach the brain. Now what the use of carbidopa then? This carbidopa will inhibit the enzyme dopa decarboxylase. Okay, so this dopa decarboxylase will get inhibited. If this gets inhibited, then you can imagine that this levodopa which we will give with carbidopa will prevent the conversion into dopamine in the systemic circulation. So in the systemic circulation there will be no conversion of levodopa into dopamine, okay, because this carbidopa will prevent the enzyme here. But as this carbidopa will not be able to enter the brain, only levodopa will enter. So in the brain this large amount of the levodopa which are reach from this systemic circulation to the brain, okay, will be able to convert into dopamine and it will carry out its action. So this is the use of carbidopa with levodopa. So now you understood that why we give levodopa to compensate for the dopamine, right? And why we give this carbidopa to prevent the peripheral conversion of levodopa to dopamine. Now what are the side effects of this drug? One is arrhythmia and other is dyskinesia. After long term use of this drug, there will be development of on and off phenomenon, and this leads to this dyskinesia. Okay, what is on and off phenomenon? On phenomenon is when the effect of the drug is on, and off phenomenon is when the effect of the drug is off. Okay, that means there is no effect of the drug. So imagine that if you given the patient one dose and this is the time for the second dose. Okay, this is first dose time and this is second dose time. Initially everything goes well, okay, when there is enough dopamine, but with time you know that there is a degenerative changes that occurs in the basal ganglia and also the neurons that are producing dopamine. So with time there will be decrease in dopamine. Okay, so with decrease in dopamine, the x amount of the dose which we are giving to this patient will not be able to compensate for that decreased dopamine over time. So what will happen is when you give the dose to the patient, he will be normal for most of the time, but by the time of the second dose, okay, before that for this much time the amount of the drug will be so less that it won't be able to compensate for the dopamine, compensate for the decreased dopamine level in the body or in the brain. So during this time there will be again symptoms of Parkinsonism, and when you give them second dose, okay, then the patient will again become normal. Now again when the time for the another dose, okay, before that there will be this symptom again. So this is known as on and off phenomenon. It occurs because of the ongoing degenerative process in the brain. Okay, so imagine that we are giving x amount of the drug, okay, and there are this y amount of neurons. After some years this y amount of neurons will be like half of the original neurons. Okay, so now this much amount of the drug cannot compensate for this much neurons because this much neurons will form very less amount of dopamine, so we need to increase the dose. Okay, but there is some limit to increasing the dose also. Okay, so with time the treatment is like it's not that much satisfactory, but yeah, this is the treatment that we have today and we are giving to the patients. And yeah, that's all for this video. If you have any doubt, you can comment. You can tell me in the comment section. And please don't forget to like and subscribe so that you don't miss any of my videos.